Assalamu alaikum to all my viewers and students. Today we are going to discuss the antacids, the classification of the antacids. Last time we have discussed the laxatives, the classification, and particularly we have discussed it from the CPR, Comprehensive Pharmacy Review, which is most importantly from the clinical point of view. Okay, so let's start the classification of the antacids. But first we need to note what are the antacids. Antacids are the class of the drug that are used for the treatment of the acidity. Now what is the acidity? Acidity is a condition in which our stomach start producing a lot of the HCl, like a lot of the acid, like the acid production in our stomach increases. That obviously cause the feeling of burning and irritation. When we eat food, we feel like this something burning in our chest, something burning in our abdomen. So this is the condition that the patients have when their stomach is producing a lot of the acids. So when we see the classification of the antacid, we see that there are the two type of the antacids. Number one, that are the systemic, and the other one that are the non-systemic. The systemic antacid get absorbed in the body and show the systemic effect as well. Obviously, as their name indicate, these drugs include the sodium bicarbonate and sodium citrate. The other class of the antacid are the non-systemic ones that do not get absorbed and neutralize the acid. Their main action is the neutralization, and the action of the antacids are the neutralization of the acid that is producing in our body. Like they do not decrease the acid secretion, but rather they neutralize that acid because they are alkalinic in nature, and that acid is obviously HCl. It is acidic in nature, so it neutralizes the acids. So the drugs that come under the non-systemic class of the antacids are the calcium carbonate, magnesium hydroxide, and aluminium hydroxide. These too much in use. Now comes toward the H2 receptor antagonist. H2 receptors are the receptors that are present in our gastric parietal cells. Okay. Histamine 2 receptors. H2 receptors are present on the gastric parietal cells. Now in the gastric parietal cell, when the histamine binds to its receptor, it causes the secretion of the hydrogen and chloride in the stomach through a series of the steps. And what are the steps we will discuss when we discuss the details of these receptor antagonists. So for now, we just need to remember that the H2 receptor antagonists are those that decreases the secretion of the hydrogen and chloride into the stomach. So basically, they are decreasing the secretion of the acid. As we know that the hydrogen and chloride get combined and form the HCl, which is an acid, which is a very strong acid. So H2 receptor antagonist, what is the work of the H2 receptor antagonist? They decreases the production of the acid. So the drugs that come under this class are the cimetidine, ranitidine, famotidine, and nizatidine. So the T-dine is the mnemonic. You can mnemonic, or you can say that it is the identification of this class, T-dine. Okay, so this is the identification of this class of the drugs that you need to remember. That whenever comes this word T-dine at the end of the drug, you just recall that it should come in your mind that it is the class of the H2 receptor antagonist. So now discuss some things about this drug. Cimetidine is less potent, and the one very important thing about cimetidine is it is very it has a lot of the drug interactions. Okay, so we just need to avoid this drug to be used in the practice, especially in the country where the polypharmacy is very much in the practice. Need to remember about cimetidine is that it has a lot of the drug interaction. Next comes the ranitidine, famotidine. Famotidine is the most potent of all. The most potent means that it's low quantity, its less amount produces the maximum effect, like 2 milligram, 4 milligram, 10 milligram produces the maximum amount, while the other drugs are producing the same amount at the high while the other drugs producing the same effect at the high amount. Like if we need 300 milligrams of ranitidine, we will need 10 to 20 milligram of famotidine to produce the same effect. So then comes the nizatidine. It does not available as a IV, while most of the drugs are available as IV in this class. So the next class of the drugs are the proton pump inhibitors. that are known as PPIs, and the identification of this class of the drug are the prazoles. Now the drugs that come under this class are the omeprazole, lansoprazole, esomeprazole, remeprazole, pantoprazole, and dexlansoprazole. Dexlansoprazole is very important. It is an expensive drug, although it is an expensive drug, but still it is a very use. It can be taken irrespective of the food, while these drugs should be taken before 30 to 1 or before a meal. And H2 receptor antagonists are also taken 30 to 1 or almost after before meal or at bedtime, while the antacid should be taken after meal because their action is the neutralization. Okay, so now comes the mucosal protective agents. Okay, now the thing which is need to be remembered is that the drugs that are available in this class as a IV. So you need to remember this acronym PAL. PAL is available as IV. PAL, what is PAL? Pantoprazole, esomeprazole, and lansoprazole. It is available as IV formulation. Now comes the mucosal protective agents. The drugs that come under this class are the sucralfate. Sucralfate is a combination of the 3 drugs: sucrose, aluminium, and sulfate. So this is a combination of the 3 drugs, sucralfate. Next comes the prostaglandin analog, which is the misoprostol. Misoprostol is a very important drug, but it has a number of the side effects. It can cause abortion, so it must be used with the great care and caution because it can cause abortion. Next comes the bismuth compound. Bismuth compound. In the bismuth compound, we will see that bismuth subsalicylate and bismuth subsuccinate potassium. So we have discussed antacids, we have discussed H2 receptor antagonists, and we have discussed the proton pump inhibitors. And what are the proton pump inhibitors? I didn't give you the idea of this, but let me. Proton pump inhibitors are the class of the drug that inhibit the proton pump, as the name indicates. Now, what is the proton pump? Proton, as we all know, is the hydrogen. So, proton pumps regulates the secretion of the hydrogen ion. So when this pump is inhibited, the hydrogen ion will not get secreted, and the combination that is formed from the secretion of the hydrogen and chloride will not be resulted. So the hydrogen, and when the hydrogen is absent, the chloride will not alone form the acid. So this is how the secretion of the acid is decreased. So this is all about the antacid. What are the antacid? Hydrogen pump, hydrogen receptor antagonist, H2RA, and PPIs, and the mucosal protective agents. So this is all about the classification. We will discuss all of the drug in the details. So we will discuss all of the drugs in detail. So to get notified about the upcoming videos, upcoming lectures, subscribe to my channel and share it with your friends. Until next video, Allah Hafiz.